Welcome to our glucose regulation lesson. The purpose of this video is to provide you with real-world nursing education beyond just this nurse workbook alone. So most of the time people think high blood sugar or low blood sugar, they usually think diabetes. Well, there's actually many reasons that we can have a low blood sugar or high blood sugar, and it doesn't always have to be diabetic related. So this video, although it may seem basic, is going to be a great video to help you lay foundations all about blood sugar and its effects on our bodies if we have certain types of conditions or illnesses. So let's jump in. So our first condition is going to be our hypoglycemia. And this is going to be a blood glucose that falls below 70 milligrams per deciliter. So this is essentially an abnormally low level of glucose in the body. And since glucose is our primary source of energy for the body's cells, a stable blood glucose level is going to be critical for normal bodily functions. So we can get this hypoglycemia by potentially excessive insulin. So too much insulin is moving all of our blood sugar out of the bloodstream and into the cells. But this can also be from a lack of nutrition. So we're not getting enough daily blood sugar. And this could be from vomiting, because vomiting is always preventing any intake of food entering the body and providing glucose. And we can also see this with elevated metabolic needs. And we could think of this as a fever, for example, and this could deplete our glucose reserves that we have quicker than we're able to fuel it. And lastly, this can happen in liver disease, and this is because the liver plays a central role in glucose homeostasis. So the liver actually assists with production, storage, and the release of glucose. So in conditions like a cirrhosis or even a hepatitis, this could always impair that entire process. And signs and symptoms of hypoglycemia or low blood sugar are going to be very obvious. So we can have that cool and clammy skin. We'll see sweating or diaphoresis. We'll see palpitations and some irritability. We can also see weakness, altered mental status, and anxiety. And all of these symptoms are happening because this is our fight or flight, that sympathetic nervous system. If we remember from our previous lesson, it's the car, the speed, it's elevating everything because it's feeling like it's in a horrible situation and it's got to tell the body that needs to compensate for this situation. So it's going to release our epinephrine and our adrenaline, and this can also give us that racing heart, the palpitations. In addition, our brain is primarily fueled by glucose. So if we're not getting enough glucose, we're going to have that confusion, that anxiety, and our brain letting us know that it's not getting fuel. And this can actually lead to seizures or even a coma. There are two different ways that we treat hypoglycemia, but there are two questions that you need to ask yourself if you have a patient with hypoglycemia. Are they conscious and do they have an IV? So in an unconscious patient, we're going to give them glucagon. This can be either IV or IM. And we can also give them 50% dextrose IV as well. And this is going to be preferred and the fastest. So what is the difference between both of these? Well, glucagon is actually telling our liver to release any of the stored glucose that's there. So it's a little bit longer acting, but dextrose is going to be straight sugar to the bloodstream. So our unconscious patient isn't going to be able to help us. So we need to give them that intervention quickly. But in a conscious patient, they are able to help themselves. So oftentimes we're just going to give them a simple carbohydrate and some glucose. So this could be a juice box or candy or even some fruit. And then we have the opposite condition, and this is our hyperglycemia, and this is blood glucose that's above 100. So this is an abnormally high level of glucose or sugar that's in the bloodstream. So this is a primary concern in our individuals that have diabetes mellitus. And this can occasionally occur in individuals without diabetes, and that happens under certain circumstances. So in our diabetic patients, this could be from an absence or insufficient protection of insulin. And this can be potentially their diabetes is not diagnosed yet or they're not being treated. And this can also occur with reduced sensitivity of the body's insulin and eventual decrease in insulin. And this happens in our non-diabetic patients from certain medications that can cause a low blood sugar or even an acute illness or infections. We can see a low blood sugar in severe sepsis and endocrine disorders like our Cushing's or acromegaly. So in a condition like sepsis, this inflammatory response system, this can trigger stress hormones like our cortisol, our glucagon, our catecholamines. And so this can actually inhibit the effects of insulin, and this can cause our liver to increase glucose production, and then that can cause hyperglycemia. And in those endocrine disorders, that can mess with our insulin, and so this also can cause the hyperglycemia. So our signs and symptoms of hyperglycemia are going to be obvious, just like our hypoglycemics. So we can see frequent urination or that polyuria. And when blood glucose levels are high, the kidneys can actually filter more glucose than they can reabsorb. So this is actually going to pull more water into the urine, and this is going to result in an excessive amount of urination and frequency because the body is trying to get rid of all of this glucose. We can also see unintended weight loss, and this means the body can't utilize this glucose for energy, so it starts to break down fat and muscle stores that can lead to this weight loss. We'll also see slow healing wounds because high blood sugar levels impair blood flow and damage nerves. So this can reduce our ability to reach areas in the need of healing. We can also see blurred vision, and this is because high blood sugar can cause the lens inside the eye to swell. So this changes its shape and flexibility and can lead to temporary changes in vision. And persistent high glucose levels can actually damage the blood vessels in the retina, and this can lead to permanent vision loss. We'll also see excessive thirst due to the increase in urine production, that polyuria, that's going to lead to dehydration and trigger that sensation of thirst as our body's trying to replenish all the lost fluid. We can see frequent infections because high glucose levels can weaken the immune system and it makes it harder for the body to fight off. And glucose-rich environments actually promote growth of pathogens, so we can see a lot of this growth flourish in things like the urinary tract and skin. We'll also see fatigue. Since glucose cannot effectively enter the cells to be used as energy due to the insulin resistance or the lack of insulin, this leads to that energy shortage in our body, and this fatigue occurs. And we'll have headaches, and this is that fluctuation in blood glucose levels that can lead to these headaches that are a result usually of dehydration and the body's overall stress from trying to balance out these glucose levels. And if we're unable to get the blood sugar levels regulated and hyperglycemia happens over a long period of time, this can be extremely harmful to our body. So consistently elevated blood sugars can damage blood vessels and our nerves and lead to heart disease, stroke, kidney disease, neuropathy, and eye problems, among many others. Unhealthy diets, sedentary lifestyles, stress, and other factors can contribute to the development of insulin resistance and the onset of diabetes, which increases the risk of hyperglycemia. And we're going to talk so much more into prolonged hyperglycemia in our next lesson. But before we go, we want to revisit 4 of our medical terminology words so we can really drill these into our head. So what exactly is glucagon? Well, this stimulates the release of glucose from liver glycogen stores, but it also relaxes smooth muscles and can be given for esophageal food obstruction. So when it's Thanksgiving time, it's not uncommon to have people complaining that they have some meat or some turkey stuck in their throat. So this is another time that we can use glucagon, so it helps relax that muscle, and then hopefully that food will pass. And this, of course, is only done if this is not obstructing their airway of any sort. Our hyperglycemia that we just talked about, remember this increases risks for infection. So high glucose harbors bacteria and yeast. And our steroids, they increase the release of glycogen in the liver, and it contributes to insulin resistance. And this can be with any type of steroids, whether this is steroid abuse or even in steroids that we may need for some kind of overwhelming inflammatory infection or response going on. And lastly, our insulin. One thing we don't want to forget, although in our previous video we learned about how insulin works, but insulin doesn't only push glucose into the cell, it's also pushing in water and potassium into our cells. And this is going to be really important when we talk all about our DKA interventions. And this concludes our lesson. I will see you in the next one.